thank you for joining us today. My name is Carrie Schreier. I'm an extension educator with MSU Extension's Children and Youth Institute. And joining us today to talk about back to school vaccines, we have Katie, and I'll let her go ahead and introduce herself.
Hi, good afternoon. My name is Katie Stanulis. I'm a family nurse practitioner. My practice is in East Lansing with a family medicine practice as part of Sparrow. And I've been a practicing nurse for 17 years, and I am in my 8th year of practice as a family nurse practitioner. And I'm really excited and glad to be back here talking to you guys again today.
Thank you so much for joining us. Yeah, we've been fortunate to have Katie on before. And again, I want to remind everyone as we get going here that the purpose of our conversations today is to allow you to be able to ask questions. So if you have questions, please feel free to put them in the chat or the Q&A. If you're joining us on Zoom, you can also add them in the comment box on Facebook. We are going to be dropping a demographic link in the chat, so we'd appreciate people taking the time to complete that demographic link. And while the link appears in the chat, we're going to begin today with a short video talking about meningitis and the effects of meningitis.
When each of my babies were born, I promised to always love and protect them. I thought that I was doing that. Oh, Emily, I miss you so much. When I sent my daughter off to college, along with all sorts of advice, I sent her fully vaccinated with everything that was available at that time. My Emily called me one Thursday night with a headache, a simple headache. I thought maybe the flu. She thought lack of sleep. We said goodnight. By the next morning, my precious 19-year-old daughter was in a coma. Within 30 hours, she was declared brain dead. My daughter had meningococcal meningitis, serogroup B. We don't know how she got it. No one else around her got it. I promised you I would always protect you, and I couldn't. I didn't know. I didn't think it was possible for my daughter to have this disease because she was vaccinated. It turned out that the meningitis shot my daughter had received at age 11 and again at 17 was actually called the conjugate or the quadrivalent meningitis vaccine. It protected her against 4 serogroups, A, C, W, and Y, but not B. It turns out that the serogroup B vaccine that would have protected my daughter was not yet available in the United States. It is now. There are 2 MenB series approved and available now for ages 10 to 25, though they are using these vaccines even more broadly in other countries. It doesn't matter how rare you are told this disease is. I promise you that if this is your child, it might as well be a million. Our lives are changed forever. I miss you every single day. It's like a bad dream that just never ends. I could not protect my daughter because I did not have the knowledge or the vaccine. You do now. Ask your medical provider and be persistent. Don't take no for an answer. Remember, protection from this dreadful disease means protection from all 5 serogroups. Know the symptoms and treat them like an emergency. Early attention could be the difference between life and death. Contact the Emily Stillman Foundation for more information.
Oh, that's such a sad story. I know as a parent of a college student, that really touches very personally to me. We made sure that she had her vaccines heading off to college, and I didn't know that there was a different type of a meningitis vaccine. Can you talk a little bit about that?
I can, yes. What that mother there referenced in the video is the meningococcal conjugate vaccine, which has been around for a lot longer, which covers those 4 different strains she mentioned, the A, C, W, and Y. And that one's been pretty widely used for many years, and we give it around age 11 or 12, and then a second dose is recommended after age 16. The meningitis B vaccine is a separate one, and that's been available, I don't know the time frame, definitely in the last probably 8 to 10 years. here in the US. And it is recommended, but not required for schools. So I see a little less uptake on it, I think, partly because of that reason. But it is one that's really important. And I'm having conversations with my teenage patients and their parents a lot about this vaccine. And that's it's a scary real life example because meningitis is a really severe disease and it does take hold really fast and can be fatal, like that mother mentioned, within 24 to 48 hours.
I remember as a student at MSU in the 90s, we actually had a meningitis outbreak in the dorms at MSU. And yeah, it's scary.
Yeah.
Is there anything else you'd like to share about that before we move on?
Not specifically, no.
All right. We're going to jump right in and talk a little bit here about what vaccines are recommended by age group. And I know that this is a really broad question, but I think as a parent, I think about turning in vaccine records maybe when my kids were going into their early childhood programs, into kindergarten, and then again when they were in like 7th grade. So you talk a little bit about those different groupings and what parents need to be looking for?
Yeah, absolutely. So yeah, you're right. It's a pretty broad topic, right? There's a lot. So I'm just going to give a brief skim of general by age group. And then just one caveat I wanted to mention is that these are generally for healthy kids. So for some kids who have chronic illnesses like chronic heart disease, kidney disease, immune conditions, there's some different recommendations. So this is going to be for the majority of kids. So I just wanted to make sure I pointed that out. So we're going to start it. I thought we'd start with the youngest group. So like the preschool, nursery school, like the 2 to 3 year old range. So generally at that point, they have had the bulk of their kind of, like the infant and toddler immunizations. There's DTaP, which is diphtheria, acellular pertussis, and tetanus. There's the polio vaccine series, Haemophilus influenza B series, hepatitis B, pneumonia, measles, mumps, rubella. They should have had at least one of those, and then one of their varicella or chickenpox vaccines, the hepatitis A series, and then flu and COVID-19, depending on their age. And then, so that's a big push. And then the next big push, which we get more emphasis on, I think, because when we're talking about kids coming into kindergarten in Michigan schools, there's some that are required. And these are included in that 4 to 6 year old age group. By then they should have had 5 of the DTaP, 4 of polio, 3 to 4 Haemophilus influenza B, depending on which type they got. Their Hep B series should be complete. Their pneumonia vaccine series should be complete. Their measles, mumps, rubella, and varicella should be complete. Hepatitis A, and then again, influenza and COVID, depending on age and what time of year it is. And then for the next kind of group, the like later elementary, 11 to 12 year old, I always say between kind of like 7 and 10, kids get a little bit of break from vaccines aside from like the annual flu and the COVID vaccines. So when we get to that 11, 12 year old range, we talk about another tetanus, diphtheria, and acellular pertussis. That one's called something we call it TDAP, and just because that formulation is not for the younger children, it's for people age 7 and older. That's when we start their first meningitis vaccine. HPV is one we discuss and recommend in that age group. And then again, flu and COVID-19. And then for our little bit older adolescents, starting at 16, that second meningitis that we touched on earlier, the meningitis B that we also briefly touched on, HPV if that hasn't been previously completed, and then flu and COVID again. So that's a summary of, school age.
It is definitely a broad list. I think that for me as a parent, I know one of the key takeaways of this message was to make sure that we were checking at those sort of check-in times to make sure that we really had everything done. And I imagine now, I know for my family coming out of the pandemic, I had to get my kids caught up because we'd missed a couple in-person visits or one in-person visit. So we needed to catch up with a few there. So definitely a good time for parents to be keeping an eye on that.
Yeah.
Our next question is about when you recommend getting vaccines. How far in advance of school starting, or should parents keep them tied to their birthdays? When should parents be getting these vaccines?
Yeah, that's a really great question. It's going to depend on the child's age and what their previous vaccine history is, where they're at. Are they up to date? Are they behind? And certainly the general kind of rule of thumb is after you have a vaccine, we're looking at about 2 weeks before you're really seeing that full immunity, at least depending on which one it is. Ideally, if you can make sure your kids are getting up to date late July, early August. That doesn't always work out time-wise. In my practice, I see a lot more kids in the summer, a lot. One, because they're off school, right? So parents don't have to pull them out of school to come in.
Yep.
And it tends to be, I call it my child check and sports physical season, right?
Yep.
So especially my middle school, high school kids, we're trying to get them all in so that they're ready to roll by end of August for sports physicals and stuff. So ideally, at least 2 weeks before they're going back to school, but really anytime is an opportunity to vaccinate, and we'll see them anytime and we will give them those vaccines.
Anytime. And on that, as we're thinking about timing of vaccines, does that hold true for flu and COVID vaccines as well, that they would be getting them at that time of the year, or would that be a separate appointment later on?
It depends on when your kid's visit is, right? Yeah. So summer is definitely too early for flu. I believe it is approved, the flu shot at least, to give as early as August. But what we know about the influenza vaccine is we've got pretty good coverage for about 6 months after we get one. If you get it in August, that will cover you through February. But if we have a little bit of a later flu season and we're having a spike into March, or I've seen cases even in April, then you lose that coverage then. And generally late September into definitely by the end of October is what I recommend for my patients and myself and my family as an optimal time to get the flu vaccine. Okay. And then with COVID vaccine, we can circle back to that, but there's some newer information coming about that.
Yeah, I think we'll delve into that a little bit further as we move ahead. I know we've got some things changing there, or not changing necessarily, but moving. Our next question is about what vaccines are required to go to school in Michigan. So I know some vaccines are recommended, some are required by, or strongly recommended by the CDC or the American Academy of Pediatrics, but not necessarily the state. Could you talk a little bit about the difference there and what's required?
Absolutely. So it's going to vary a little bit by state, but so for Michigan, since we live here in Michigan, we'll talk about that. So for all kindergartners or like DK, pre-K, DK, whatever, the 4 to 6 year old age range there, then they need to have 4 doses of the diphtheria and tetanus and pertussis. And at least one of those has to be at or after 4 years of age. They have to have their polio series complete and their measles, mumps, rubella series complete, hepatitis B series complete, and their varicella or chickenpox series complete. So those are required for those younger kiddos. And then later, so for 7th graders or any kiddos that are in the 7 to 18 range that are transferring in, they need those 4 doses of the diphtheria, tetanus, and acellular pertussis that I mentioned for that younger group. And then at least one of those needs to be at age 11 or older. That's when they're due for that next booster after the kind of childhood push. And then in addition to that, at 11 or older, they need 1 dose of the meningitis ACY vaccine, and that they need that for entry into 7th grade or higher.
Okay, great. And I think we have a link we can add into the chat that shows that, so parents can see what those vaccines that are required to go to school in Michigan.
Yeah.
Why do schools check for vaccines?
Yeah.
Why is this something that schools are involved in at all? Can you talk a little bit about that?
Absolutely. It's the school, anytime we bring large groups of people together, we share lots of things, information and conversation, but we also share germs. I'm sure a lot of parents, especially parents of young children, are aware when they first sent those kiddos off to whether it was daycare or their preschool, that that kid, then subsequently that family is sick. Like it seems like with something else about every 3 weeks. The requirement for these vaccines is it's a minimum standard for preventing disease outbreaks in school. So in this core group of vaccines that's required for Michigan, these vaccines have been around for many years and are very well researched and safe. And we've been able to keep people out of these crime with these schools. Yeah, we're trying to keep sickness in general, but also protects teachers from getting sick and having to miss. It protects the kids from getting sick and having to miss, and then subsequently anybody that those kids touch in their regular life, whether that be parents, grandparents, other caregivers.
Yeah, definitely makes sense. And do you know when they check, or when is there a certain time that those
Yeah.
checks are done?
So generally upon like enrolling in a school system for the first time, whether it's your pre-K or kindergarten, or if you're transferring in, they typically want you to provide that documentation. And then I believe they check for follow-up and consistency. I believe in Michigan, there's a November date that if your kid's not up to date, there's a few holes. You have a little bit of wiggle room to, if you need maybe that one last DTaP, to get that before November so they can still start on time with the regular school year.
Yeah, we ran right into that November cutoff with catching up with our missed COVID vaccines, and had to get my hurry up to try to get an appointment for my daughter in so that she could get it in before then, because I hadn't realized that she was missing that vaccine. Great.
Yeah.
All right. And speaking of trying to get those appointments in, it's been challenging sometimes for parents to get appointments and get their kids in for physicals. And I know those annual physical appointments can schedule out quite a ways. Our next question asks if your child's physical is scheduled after the date that the school is requiring you to have your vaccines in, what does a parent do in that situation?
Yeah, that's a great question. So the good news is that we have lots of options. So vaccines don't have to always be done as part of a physical or well check. They can be done at any visit. So sports physicals, for example, let's say, I saw a teenager this week whose well visit we did in January. And then he switched from homeschool to public school. And so he needed a sports physical for the first time. So I saw him this week for a sports physical. And I talked to him about immunizations. We do it every visit. So even if your kid's in, if they have an ankle injury and you're coming in for that. And if there's immunizations that are due, that is an opportunity for the parent and the child and the medical provider to capture that when possible. And then additionally, so some, maybe not so much in family medicine, but like in pediatric clinics, they'll have walk-in clinics for vaccines, or some sort of, clinic day where parents just come in and either the medical assistant or the nurse takes a look at their record and sees what they're due for. And typically, most offices, if that child has been seen in the last year, seen and evaluated, it's okay and safe for them to come in and get vaccines in that capacity and then come back maybe for their well check later. Local health departments are a great option. Typically, all of our local health departments have an immunization clinic that you can call and get scheduled for an appointment. And they come in and you meet with the nurse and they go over what's due and they can administer all vaccines there. And then actually, like, local retail pharmacies are a great resource for vaccines. There's probably a little bit less availability for kids versus adults. And it's good to know before you just show up, like, what they have, but pharmacists are actually trained and licensed to administer vaccines here in Michigan. So that's another great resource. So we have lots of options outside of that visit or physical where you can get your kids caught up on their vaccines.
That's such great information. I think I know as a parent, I regularly forget that you can make those nurse visits to just get in and get a vaccine and not necessarily wait to see the doctor and go through the whole thing. Okay. Our next question here is about why the schools aren't recommending all of the vaccines that the pediatrician is recommending. And I know we touched a little bit on that kind of balance of this is everything that's recommended, but this is what the school requires. Can you talk about why there's a difference there?
Yeah, absolutely. And I think it goes back to what we talked about, that this is the ones that are required for the state of Michigan. How they word it is it's the minimum. They have the minimum standard for preventing disease outbreaks in the school setting. Some of the other ones that aren't required that we touched on when we did that summary, let me flip back to my list, is so influenza and COVID being two of the big ones, right? But pretty much all the other, and the Haemophilus and the that's required. So obviously I'm not a part of whoever the decision makers were that chose these are the ones that are required, but typically the required ones, again, cause a huge burden of disease. Not that the recommended ones don't, but again, with the flu and COVID, with these kind of seasonal patterns, I think also it would be a lot harder to get kids and parents to comply with the requirement for seasonal flu. And we can talk a little more detail about the flu shot and COVID vaccine too, but yeah. And as the kids get older too, that like the HPV vaccine series, there's a lot of emotion and a lot of strong feelings around that one. And yeah, so I think ideally we're hoping that kids aren't transmitting HPV during school hours. I sure hope not, at least.
I hope not. We actually do have a webinar about HPV specifically. So if people have more questions about HPV, we have a whole hour about it, with a lot of great information there. We've addressed a couple of our questions, and so I'm just going to move a little bit ahead here. And I know this must vary a lot, but how far in advance would you say you generally need to be scheduling an appointment to get in for vaccines or well visits?
Sure, that's a great question. And I think that's going to vary a lot depending on our geographical location and access to care. Not all kids have an established pediatrician or medical providers. And it's going to vary, I think, on staffing levels and hours at local health departments or, specific pediatric offices or other primary offices. I think that in my experience in my office, for just like, we call them clinical support visits, or it's essentially a nurse visit where people can come in and just get immunizations. We can get people scheduled within a week, which is great, which is really great. But we offer them pretty much for a couple hour chunks of time, pretty much every day. But some clinics have different times. For example, like where I and myself and my son go for care, they only have certain days of the week that they do the clinical support visits. Scheduling wise, you may need to give yourself a little more time. The retail pharmacies, I know a lot of them, you can sign up online for an appointment and put right in there what vaccines you want. And that's a really great way to be able to do that just electronically within a few days even. So I think there's going to be a lot of variation. And like we touched on earlier, if you're trying to get your kid in for their physical or well visit, right? Typically, most offices, we're booking out a few months for that. It really depends because we as providers, we have different kind of templates on our schedule that we work off. So we have, when we can, a balanced day, right? Between well visits and acute sick visits and chronic management visits and procedures. So we can't just fit those well visits in wherever. So it takes a little planning. So for me to get in with me, probably for a well visit for a kid, we're looking at least a month. For some of the physicians I work with, if people feel really strongly about wanting to see the primary care physician, we're looking at 3 months right now. So there's a pretty big variation. And like I said, it's really going to depend on what sort of a setting you're scheduling into to get those.
It really can be quite a ways. I know we're waiting 3 months to get my daughter in for her annual visit. But along that point, there is that mention that, again, that you can get in for those vaccine visits or nurse visits or sick visits if somebody is ill. Those are different than our annual physical visits.
Yeah.
Great. We have an audience question that came up, and this is something I think we touched on earlier, and hopefully we can find a link to drop in here for her. The question is, what vaccinations are required to enter childcare or preschool for a 2 to 4 year old? Where we'd find that information?
Yeah, that's a great question. And I think some of that for the specific, whether it's the daycare or preschool, should have what their solid information on what their requirements are. I'll circle back to that list that I went over at the beginning for the 2 to 3 year age group. We're again looking at 4 of the DTaP, the polio vaccine series, the Hib series, which is Haemophilus influenza B, hepatitis B series, the pneumonia series, at least 1 of the measles, mumps, rubella, 1 varicella, 2 hepatitis A, and then influenza and COVID, depending again on age group and time of year. But I think reaching out to the specific daycare provider or preschool, they should have specific information on that. And again, the CDC website has just phenomenal resources in so many different ways to process it. If you prefer to read through something, they have charts in all different colors based on age group, and if it's your on time or if it's a catch up. So there's lots of ways where we can physically look at that list. And again, like here in Michigan, we use something, we call it the MICR for short. It's the Michigan Care Improvement Registry. So there is mandatory reporting for all vaccines that are given to Michigan residents within, I believe it's within 48 hours of administration, have to be reported to this sort of central agency so that those are all tracked for the state. And so that you can always look at to see what your kid has had. And so the top half of it is what has been given and what dates. And then the bottom half of it will tell you if a series is complete or when the next vaccine is due. So that's a great reference. It makes it really clear.
That's where those handy printouts come from when you go to the doctor's office.
Yeah.
And updated record, and it's got I
Mhm.
appreciate those. It's nice to see where everything is and where we are.
Yeah.
And I know I'm always asked, I don't know, on every form I'm asked when my child's last tetanus was, and I have 4 kids and I don't always remember
Oh.
when it's last.
Yeah.
In fact, I often don't have enough trouble with their shoe sizes,
Uh-huh.
let alone when their last tetanus vaccine was. Great.
Mm.
Thanks. And as you just listed off all of the
Yeah.
vaccines that are due in that early age, it ties right into our next question. Is it safe to be getting more than one vaccine at once? And can you touch base on the combo vaccines? If a child's got to get a bunch, maybe to get caught up or to enroll in school, or just simply at the regular visits where they may get 4 or 5 vaccines.
Exactly. Yes. And I think for parents and the kids, the thought of getting 4 or 6 immunizations at a time seems like a lot, but that standard CDC schedule has been tested and is tried and true and is absolutely safe to get those at the same time. Again, and these are for our healthy kiddos, right? Generally healthy kiddos. Yes. And really the only contraindications for this healthy group of kids to getting vaccines is documented severe allergic reaction like anaphylaxis, which is incredibly rare, or like a moderate to severe illness. So if I was seeing a kid for a sick visit, let's say they're 6 and they're getting ready to go into 1st grade and they're a little bit behind and they somehow they missed their second varicella or chickenpox vaccine. And I'm seeing them, and if I'm diagnosing them with a pneumonia or strep and they're feverish, that's not the best day to give them a vaccine because their immune system's already under assault from that bacterial infection, right? That is one of the very few instances that I would say, we probably shouldn't do this today, but let's schedule a time in a week or 2 when they're healthy to get caught up.
Back in.
Yeah. But yeah, and there's combo vaccines. And what that means is that up to 3, depending on what there's lots of different ones, but there's now one MMR and varicella are together in one live vaccine. So it's 1 poke instead of 2. And there's another combo that I believe is DTaP, polio, and Hep B. So 3 in just 1 needle. So yeah, just last week I saw a kiddo, I'm trying to think, she's either 4 or 5, and she had maybe four vaccines that she needed, and she just needed 2 pokes. It might even been 5 because I think we were able to do 2 combo vaccines. And so I was really excited to be able to say, okay, because in the conversation with the parent, well, we're due for 5, but I was like, great news, only 2 pokes today. So kids and the parents usually appreciate that.
Yeah, I appreciate your answer to that question. And I'm going to ask one more question here, and then I want to loop back because we have a question that came in from a participant.
Sure.
The next question we had on our list is about what negative effects there may be if you delay your children's vaccines from their recommended schedule.
Yeah, that's a great question. And I get that one a lot. Yeah. Anytime we're delaying when we could have had immunity in a more timely manner, there's more risk for burden of disease, for getting these acute infections that we're trying to prevent. But we are never going to say generally, oh, it's too late. Like, you're behind schedule. Let's just forget it. There are a few vaccines that if you don't get them on the recommended schedule, that kids age out and honestly, I think that's probably because by that age, they've probably been exposed and had that illness. So they probably have some natural immunity. But yeah, doing the best we can to stick to that schedule. It's set up like that for a reason. And again, that big push really before kindergarten, right? When for most kids, for the first time, they are coming into that big group setting where they are just sharing all those germs.
And they do share them. They do.
Mm-hmm.
All right. We're going to shift a little bit at this point to talk about COVID vaccines. And before I get into some of the specific COVID questions, I'm wondering if you could just talk a little bit about the current COVID vaccination recommendations. What are kids supposed to get? When are they supposed to get them? Where are we with our current COVID vaccine recommendations?
Mm-hmm. I wish it was really simple and clear, but we have a couple different options for COVID vaccines for kids, different brands. The good news is generally When the COVID vaccines first came out, there was like an initial 2-shot series, like for the Moderna and the Pfizer. And then you couldn't have a booster until you'd had that done. That's not the case anymore. The initial series does not preclude you from getting a booster any longer. And that goes for kids as well. So that makes it easier, especially for us as care providers too, that there was a period of time where we only had the booster, and then people would be coming in, they haven't had their original series, and they'd be on the like considering getting vaccinated, but then I'd have to say, I don't have that one to give you. So yeah, exactly. And then of course the chances of them actually following through and going somewhere else is right. Anyways, I'm going to be a little bit vague only because we are on the cusp of waiting for approval in probably the next couple of weeks for a new updated COVID booster that has been modified to try to cover some of the circulating variants, right? These mutations that we've had since the last booster became available last September. So I would expect more information in the coming weeks. But if you haven't been, well, for kids, hold on, I gotta put my there's different recommendations for adults versus the kiddos. So generally we want, if your kid hasn't had a booster since last fall, they're definitely due for one. But like I said, I would expect in the next few weeks, we are going to have new information and recommendations on next round of boosters for kids. And I would anticipate in the future, kind of going forward, is because we're still learning a lot about COVID, right? Like we're in year 3-4 of this, but we're still learning a lot. But we are generally seeing a big surge in late fall and early winter, like we do with influenza. They're not the same beast, right? But I would anticipate that we are probably looking at more of an annual COVID shot. Like we recommend the annual flu shot going forward. Maybe some additional recommendeds for additional boosters in between for people that are older and immunocompromised. But again, the data is still rolling in and the science is still fairly new for COVID, and the medical community is trying to gather and process the information as fast, but also as thoroughly and safely as they can, and then make decisions and recommendations going forward.
Great. And we have a few COVID related questions here, and I know we might not have all the answers right now because again, like you shared, we're anticipating a new booster to come out here.
Yeah.
The next question though is about what you could do to reassure a friend or a loved one if they were worried about getting their child vaccinated, especially for COVID-19. And I know there were some specific concerns around that COVID-19 vaccine and how it was designed and stuff. Can you talk a little bit about what you might say to a friend if I'm your friend, Carrie, and you want to reassure me because I'm worried about getting my kids vaccinated? What could you say, or what would you say?
I think first, most importantly, is like asking, what are you most concerned about? What is the fear? What is the fear that you just don't know? Is it a specific side effect? Is it something you saw posted on Facebook or TikTok? More and more patients telling me, they'll come in and they say, I saw something on TikTok. And I was like, okay, so we're using this as a news source now. That's interesting.
Yep.
Yeah. So find out what the fear is. And then as a medical provider, again, just providing the clear, scientific, unbiased information without judgment and just factual information at their level of understanding, I think is really important. And then I also, a lot of time with friends or my patients will share my personal experience. I'm a mom. I have a 7-year-old, and when he was an infant, when I was bringing him in for that first 2-month visit, and I knew there was like 6 vaccines in his future that day, I was like, oh man, is this really a good idea? And I hemmed and hawed about it. And ultimately, after a conversation with his provider, I did them all. And then we continued to do everything on the regular schedule. And he's done great. We've had no problems with it. And that generally is the case for 98-9% of kids, healthy kids. But I think just being honest that, hey, even though I'm a medical provider, I had some of those worries for my own kid too. I think it makes it a little bit more real. And so they know that I understand, but then also that I still chose to fully vaccinate, and we've had a great outcome.
Sure.
Mm-hmm.
Great. I appreciate that feedback. thinking again a little bit about the COVID-19 vaccine, I know we're hearing, and again, feel free to pass on some of these COVID questions if you're not quite sure of the answer. But one of the questions we have here is about why the COVID cases are rising again, if many of us are already vaccinated. And I know we're hearing reports that the COVID cases are starting to creep back up again.
Yeah. So we've had a kind of a late summer uptick here, and there's a lot of chatter about some new variants. I can't remember all the specific. There's like an E5 maybe, and then like a BA something. I can't keep up on all the, I don't know. And then they have a nickname for one of them. But what I do know is, right, the virus is mutating, and that's what viruses do, because the virus's prerogative is to keep replicating in hosts and transmit itself to as many hosts as possible. That's just how they work. So it's these mutations that we're seeing. And again, also too, yes, for like most kiddos, or like for myself, example, as an adult, like my last COVID booster was in fall last year. And because I don't have a chronic health condition, an additional one hasn't been recommended for me since then. So I'm a year out from my last boost there. So immunity is waning. So that's a piece of it too. And then, as we know, a lot of the social distancing and masking guidelines have been really scaled back or taken away. Like even in my office where I work, we're only requiring masks for patients that are having acute respiratory symptoms. And us as caregivers, we can choose to, but we don't have to mask any longer. And that really just came down in the last couple of months. So I think there's a lot of different factors at play, but a big part of it being the mutations and then just waning immunity because of how long it's been since the last booster.
Yeah, I think we already touched a little bit on this question, but I do want to just ask it while we're discussing COVID. We mentioned earlier that COVID vaccines are not part of the required school schedule. So does that mean that kids don't need to get them if they're not on that required school schedule, or that they're less important?
It definitely does not mean that they shouldn't get them. They're highly recommended. And again, it's about reducing that disease burden, missed school days, missed work days, transmitting it to other family members and potential vulnerable people. So yeah, just because it's not required for school. And I think there's very few schools that are requiring COVID vaccines. Maybe private schools and such, maybe. I'm thinking it's still really important. Really important.
Yeah, definitely is. Some other questions, or a couple more questions we have here in our last few minutes. We know that the flu shot is something that we get annually. Can you talk a little bit about why we have to get a flu shot every year, and why the flu shot is different from our other vaccines that we're getting regularly?
Yeah, absolutely. So the annual influenza vaccine is recommended for everybody 6 months old and older every year, in the fall generally. So flu season, I think, like I mentioned earlier, technically starts, we can give flu shots as early as August, and it runs all the way through April. So anytime I'm seeing somebody during that sort of time frame, we are having a conversation about a flu vaccine. And we call it an annual flu shot because it is a different formulation every year. And we do that because flu mutates pretty rapidly. And generally, what the vaccine developers are doing is looking at the data for the but let me give an example. So right now, in the southern hemisphere of the world, we're coming into fall, they're coming into spring and then summer, right? So they are just coming out of their fall, winter, and flu season. So they use the data on those strains that were circulating in strongest there. They're going to use that information to develop next fall's flu shot. And then it goes the other way too, right? So whatever our circulating variants are now, we're going to use that data to help them develop the flu shot for next season on the southern hemisphere of the world. So again, it's about, as scientists, collecting the data and trying to have the most up-to-date information, and then making changes to it to get, and it's not perfect. We're predicting what strains are going to be strongest or more widely circulating for this flu season. A good coverage for flu season for the vaccine is like 50 to 60%. Some years we only get like 20. And to some people that may not seem like really good numbers, but we're doing the best we can with what we have. And what I always tell patients too is that even if it's one of those years when we only get like 20% coverage, you at least have fresh antibodies to a couple of strains. And even if you were to get one of those, generally the disease course should be less severe and shorter than had you had not had that flu shot and not had that boost in immunity.
Yeah. And you don't want the flu. That's not a fun thing to have. It really can take you down.
Mm-hmm.
Having it be more mild would be lovely if you do have to get it.
Mm-hmm.
Okay. Our next question is not so much about getting the vaccines, but about kids and their reaction to vaccines. And I know you said earlier, we can sometimes do things to reduce the pokes, combo vaccines. The question here is, my kids are terrified about getting shots. Do you have any idea about how to make that experience easier for them?
Yeah. Yeah. And I see a wide range of that, right? I've got some kids that come in and are super brave and don't shed a tear and they're out the door. And then we've got the screamers that we've got 2 parents and 3 staff members in there just trying to hold them down. So yeah. So I think using like the combo vaccines when possible, so there's less pokes, right, is always helpful. And I always talk to even my littlest kids. I'm like, this is a really special medicine that we don't give to you when you are sick, but we give it to you so you don't get sick. And then just to talk through what to expect. I think kids feel in a situation like that when they don't have a lot of control. If they at least know the steps that are going to happen, they generally do better. So we're going to clean. This is going to feel cold. And then depending on how big they are, if they're littler, we usually use their legs. When they get a little older, we use the deltoid there in the upper arms. And then just let them know that it's going to be a quick pinch and it's going to hurt just for a moment. And then they're going to be fine. There are some newer things, something called a shot blocker, which is really cool. Have you heard of those?
No.
Okay. So it's this like sort of plastic disc and it's got some, I might even have one in my drawer. It's got these, they're not super sharp, but little plastic points that come off it. And what you do is you set that on the arm. You're not pushing hard, but it provides a little bit of a pressure discomfort sensation. And then the disc has this little area that's carved out where the provider is actually going to put the needle to go in. And so it's almost like a distraction because we're stimulating those cutaneous nerves with those little pokers that the kid either doesn't notice or doesn't feel that sharp poke as much. So it can make the experience a lot more comfortable. And there's lots of other distraction techniques for kids. When I was in my nurse practitioner program, I remember watching this video of a doctor who was like just using like an empty syringe and like tapping it against the baby's leg and then entertaining them with tissue.
Yep, I remember seeing this video.
And then they just swapped it out with the actual needle, did the shot and kept playing with the tissues. And the kid like flinched for a second and then went right back to being entertained by those tissues.
Distracted.
Yeah.
I know it can be hard as a parent to know you're walking in there, your baby will be crying, or you're going to have to hold down your toddler. Like it's challenging. And I totally respect parents for the challenge around that. Great. We have 2 more questions. The second to last question is about our college students. So do college students need vaccines? Is that a time? We certainly touched base on that at the beginning. Is there anything other than hepatitis B we should be considering for our college students? Or not hepatitis, meningitis.
Yeah.
Mm-hmm.
Yeah. Great question. Yes. So yeah, of course, college students need their vaccines. And I generally, especially for my late high schoolers, I am trying to make sure that I see them before they launch. Definitely that summer before. I'm like, let's check in. We want to make sure you're as healthy as possible and protected before you go to school. So definitely it's both of the meningitis vaccines, specifically the meningitis B. And the meningitis B vaccine can be given for ages 16 all the way up to 23. And again, that covers that sort of college age group, right? And why we do that is the meningitis B, you're at highest risk for transmission in those sort of group living situations like the dorm. So even some of my kids, if I was like, is college in your future? Then we're definitely to do this vaccine. But I have some other kids that do trade schools, and there are a couple trade schools where the kids actually go and live in that kind of a setting. So anytime there's that sort of group setting with a lot of people together, that's a high transmission risk. So yeah, so the meningitis B vaccines, and there's 2 brands of the meningitis B vaccines. One is branded named Bexsero, and that one, it's 2 shots, and it has to be separated by a 30-day minimum. So that one's really easy to get done even that summer before they're leaving for college. The other branded one is called Trumemba, and that one I believe has to be separated by 6 months. So that one takes a little bit more planning. The other thing about that meningitis B vaccine is you can't mix and match those brands. So if you start with Trumemba, you have to have Trumemba for your second one because they're formulated differently and it's like apples and oranges. So meningitis, and then HPV vaccine, if they haven't been previously vaccinated, that actually now is approved up to age 40. But the younger you are when you get that, the better immune response that you have. And then just other like influenza, COVID vaccine, making sure tetanus is up to date. I'm thinking about that for my college kids too.
Sure. Great. We are with that just before 1 o'clock. So I have one last question and then we'll go ahead and wrap up for today. Our last question is, what other than vaccines, what are some other measures that we can do to help make sure that our kids start school safe and have a safe and healthy school year?
Yeah. I think the basic, having come through the COVID vaccine pandemic, I really hope that everybody understands the importance of hand washing. Has it ever been talked about more than in the last 3 years, right? So it's really the simple, basic stuff. Hand washing before and after you eat, after you use the restroom, after you cough or sneeze, or anytime your hands look visibly soiled. So hand washing and or hand sanitizer if you're not physically visibly soiled with dirt and stuff on your hands. And I think definitely since the pandemic, that availability of hand sanitizer, and I know my teacher on the list of class donations is always sanitizing wipes and tissues, that, and then just always reinforcing for the kiddos to cover those coughs and sneezes, not with their hands, please, but with a sleeve or an arm. And again, like if your kids are sick, please keep them home. It's really important to allow the child to have that time to heal, but then also again, to prevent transmitting that illness to others.
Yeah, definitely. With that, we've come to the end of our hour here. This went by so fast. We appreciate your taking the time to chat with us this afternoon. Is there anything you'd like to say to wrap up before we're done?
Yeah, I really appreciate the opportunity. This has been really fun. And I hope to all those parents out there that we've just learned that back to school vaccines are any vaccine that your kid is due for, and you don't have to wait, that there's lots of opportunities to make sure that they get caught up. And as healthcare providers, we're a partner in taking care of your child, and we're here to help and answer questions and make sure that your kid's as healthy as they can be.
Great. Thank you so much. I appreciate that. That's very well put to wrap this up. We just want to help make sure our kids are as healthy as they can be. With that, we will send you on your way. I hope you have a lovely Labor Day weekend and are able to have a little bit of time off with your family. And hopefully we'll be able to have you back on one of our webinars sometime soon.
That sounds great. You too.
All right.
Have a great
Thanks.
weekend.
You too. Bye-bye.
Bye.